What if one inhaler could do two very different jobs inside your lungs? One ingredient helps calm airway inflammation, while the other helps keep your airways open. That is the idea behind Budesonide Formoterol, a combination inhaler widely used in asthma and COPD treatment. But this isn't simply a stronger version of a rescue inhaler. It has specific uses, important side effects, and different products can have different instructions. In this video, we'll explain exactly how Budesonide and Formoterol work, when this combination may be prescribed, why mouth rinsing matters, and what warning signs you should never ignore. Budesonide plus Formoterol contains two active medicines with two different jobs. Budesonide is an inhaled corticosteroid, commonly called an IX. Formoterol is a long-acting beta-2 agonist, or LABA. Together, they address two important parts of airway disease: inflammation and airway narrowing. This combination is available under several brand names depending on the country and product, including Symbicort in the United States and many other markets. To understand why this combination can be useful, first think about what happens during asthma. The airways can become inflamed, swollen, and overly sensitive. At the same time, the muscles surrounding those airways can tighten. When both problems occur, the airway becomes narrower and moving air becomes more difficult. Budesonide primarily targets the inflammation, while Formoterol relaxes the airway muscles. Budesonide is the anti-inflammatory component. It works locally in the airways to reduce inflammation and airway hyperresponsiveness. Over time, this can help reduce asthma symptoms and the likelihood of future flare-ups when used as prescribed. But Budesonide isn't an instant rescue medicine. Its role is primarily controlling inflammation rather than immediately reversing every episode of severe bronchospasm. Formoterol works differently. It stimulates beta-2 receptors in airway smooth muscle, causing those muscles to relax. This helps widen the airways and improve airflow. One interesting feature of Formoterol is that it has a relatively rapid onset compared with some other long-acting bronchodilators. But that does not mean every Budesonide/Formoterol product should automatically be used as an emergency rescue inhaler. And this is one of the most important points in this entire video. Different Budesonide/Formoterol products and treatment plans can have different instructions. Some asthma treatment strategies use Budesonide/Formoterol as both maintenance and reliever therapy, while other products or treatment plans use it primarily as a scheduled controller. The exact instructions depend on the specific product, diagnosis, age, and treatment plan prescribed by your healthcare professional. So never assume that because one person uses Budesonide/Formoterol for quick symptom relief, everyone can use their inhaler the same way. Read the instructions for your specific product and follow your prescribed asthma action plan. Now let's talk about one of the most common mistakes people make with inhaled corticosteroids. After using budesonide, some of the medicine can remain in the mouth and throat. This can increase the risk of oral thrush, a fungal infection that can cause white patches, soreness, or discomfort inside the mouth. That's why patients using inhaled corticosteroids are generally advised to rinse their mouth with water after inhalation and spit the water out, according to their product instructions. This simple step can help reduce local side effects. Some people may also develop hoarseness or throat irritation. But budesonide's effects aren't limited entirely to the mouth. Inhaled corticosteroids are designed to act mainly in the lungs, but some systemic absorption can occur. With higher doses or prolonged use, corticosteroids can potentially contribute to effects involving the adrenal glands, bones, eyes, skin, and immune system. In children, prolonged corticosteroid exposure may also affect growth, although the clinical impact depends on dose, duration, and individual factors. This doesn't mean you should be afraid of budesonide. Inhaled corticosteroids are an important part of asthma treatment for many patients, and controlling airway inflammation can provide substantial benefits. The goal is generally to use the lowest effective dose needed to maintain good disease control. Now let's look at formoterol. Because it stimulates beta-2 receptors, some patients can experience tremor, headache, nervousness, or a faster heartbeat. These effects aren't necessarily dangerous, but persistent or severe palpitations should be discussed with a healthcare professional. Some people may also experience muscle cramps or other symptoms, and because formoterol is a long-acting bronchodilator, it shouldn't be treated as though it were an ordinary short-acting rescue medicine unless the specific product and treatment plan say so. This is especially important for people with asthma. A LABA should generally not be used alone as asthma controller therapy. When used for asthma, formoterol is combined with an inhaled corticosteroid such as budesonide. This combination addresses both airway inflammation and bronchoconstriction. Now let's discuss COPD. Budesonide/formoterol may also be prescribed for certain patients with chronic obstructive pulmonary disease, depending on their symptoms, exacerbation history, and treatment plan. COPD is different from asthma, and treatment choices are individualized. Not every person with COPD needs an inhaled corticosteroid. For some COPD patients, inhaled corticosteroids can increase the risk of pneumonia, so healthcare professionals weigh potential benefits against potential risks before prescribing them. This is another reason why you shouldn't assume that an inhaler prescribed to someone with asthma is appropriate for someone with COPD or vice versa. Now let's talk about a common misconception. Is budesonide/formoterol a cure for asthma? No. Asthma is generally a chronic condition involving airway inflammation and sensitivity. This combination can control symptoms and reduce the risk of exacerbations when used appropriately, but it doesn't permanently eliminate the underlying tendency toward asthma. This is why stopping your controller medication simply because you're feeling better isn't always a good idea. In many cases, feeling better means the treatment is controlling the disease. Any step down or dose reduction should be discussed with your healthcare professional. Now let's talk about inhaler technique. Even the best medication won't work properly if it doesn't reach the lungs. Different inhalers require different techniques. Some require a slow, deep inhalation, while others require a different inhalation pattern. If you're using a pressurized metered dose inhaler, your doctor or pharmacist may recommend a spacer depending on your device and situation. Don't assume you are using your inhaler correctly just because you've used it for years. Technique can change, and small mistakes can significantly reduce the amount of medicine reaching the lungs. A useful habit is to periodically ask a healthcare professional to watch you use your inhaler. Now imagine someone using budesonide/formoterol every day, but still experiencing frequent wheezing, nighttime symptoms, or shortness of breath. They might think they simply need to take more doses. But that's not necessarily the answer. Persistent symptoms despite treatment deserve medical reassessment. Your inhaler technique could be incorrect. Your triggers may not be controlled. Your diagnosis may need reconsideration. Or your treatment plan may need adjustment. Never increase your medication on your own unless your prescribed plan specifically tells you how to do so. Now let's discuss another important issue. Missed doses. If budesonide/formoterol has been prescribed as a scheduled maintenance treatment, missing doses can reduce control of airway inflammation. But you shouldn't automatically double your next dose unless the product instructions specifically tell you to. If you forget a dose, follow the instructions for your particular inhaler, or ask your pharmacist what to do. Now let's talk about interactions and medical conditions. Tell your healthcare professional if you have significant heart disease, high blood pressure, diabetes, thyroid problems, osteoporosis, glaucoma, cataracts, liver disease, or a history of recurrent infections. This doesn't mean you cannot use budesonide/formoterol. It means your healthcare professional may need to consider these factors when choosing your treatment. Also, tell them about all prescription medicines, over-the-counter products, and supplements you're taking. Some medications can affect the way corticosteroids or beta-2 agonists work. Now here's another important warning. Don't use someone else's inhaler. Even if you have the same symptoms, the underlying condition could be completely different. An inhaler that is appropriate for one patient may not be appropriate for another. And if you've never been diagnosed with asthma or COPD, but suddenly develop significant breathing difficulty, you should not simply borrow an inhaler and assume it will solve the problem. Sudden shortness of breath can have many causes, including asthma, infection, heart problems, severe allergic reactions, and blood clots. Some of these conditions require urgent treatment. Now let's discuss what you should do during a serious breathing episode. If you are experiencing severe difficulty breathing, cannot speak normally because you're short of breath, develop blue or gray lips, become confused or extremely drowsy, or your symptoms are rapidly worsening, seek urgent medical care. Don't rely on repeated inhaler doses when your condition is clearly deteriorating. Your prescribed asthma action plan should tell you what to do during worsening symptoms, including when to seek emergency help. Now let's compare budesonide/formoterol with salbutamol. Salbutamol is a short-acting beta-2 agonist commonly used as a quick relief medicine. Budesonide/formoterol combines an inhaled corticosteroid with a long-acting beta-2 agonist. They are not simply stronger and weaker versions of the same medicine. They have different roles. And depending on the asthma treatment strategy and the specific budesonide/formoterol product, the combination may be used as maintenance therapy, reliever therapy, or both. That's why understanding your specific prescription matters. Now let's look at the most important side effects one more time. Budesonide can contribute to oral thrush, hoarseness, and throat irritation. Long-term or high-dose corticosteroid exposure can potentially contribute to systemic effects. Formoterol can cause tremor, headache, nervousness, or palpitations. For some COPD patients, inhaled corticosteroids can increase the risk of pneumonia, and allergic reactions, while uncommon, can occur. If you develop swelling of the face, lips, tongue, or throat, severe breathing difficulty, or another sign of a serious allergic reaction, seek immediate medical attention. Now here's the bigger picture. Budesonide/formoterol can be a very effective combination because it targets two different mechanisms at the same time. One component helps control inflammation, the other helps relax the airway muscles. But the medicine works best when it is used correctly, consistently, and according to the treatment plan. The biggest mistake isn't necessarily using budesonide/formoterol. The biggest mistake is using it without understanding what your particular inhaler is designed to do. Don't assume every combination inhaler has identical instructions. Don't assume more doses are always better. Don't stop controller therapy simply because you feel well. And don't ignore frequent symptoms simply because your inhaler provides temporary relief. Your breathing pattern tells an important story. If you're waking up at night with asthma symptoms, becoming breathless during ordinary activities, wheezing more frequently, or relying on rescue medication more than usual, your treatment may need reassessment. The goal isn't simply to survive each episode. The goal is good long-term control. So, let's make the key points easy to remember. Budesonide is the inhaled corticosteroid that helps reduce airway inflammation. Formoterol is the long-acting beta-2 agonist that helps relax airway muscles. Together, they can improve asthma control and, in selected patients, help manage COPD. But the exact role of the combination depends on the specific product and prescription. Rinse your mouth after using an inhaled corticosteroid according to your product instructions. Learn the correct inhaler technique. Don't exceed your prescribed dose. And know the warning signs that require urgent medical attention. Most importantly, remember this: an inhaler isn't just a device. It's a delivery system for powerful medicine. When used correctly, budesonide/formoterol can be an important part of breathing disease management. But when used incorrectly, misunderstood, or taken without proper guidance, it can create unnecessary risks. So before you take another puff, make sure you know exactly what your inhaler contains, why you're using it, and how you're supposed to use it. Because when it comes to your lungs, understanding your medicine matters. This is Behind Medicine, bringing you clear, research-based information about the medicines you use. This video is for educational purposes only and does not replace medical diagnosis, treatment, or advice from a qualified healthcare professional.